Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Breast cancer is a prevalent and challenging health issue that affects many women. As October is Breast Cancer Awareness Month, it serves as a reminder of the importance of understanding this condition. Aside from its physical impacts, breast cancer can have significant emotional and psychological effects on individuals, affecting their self esteem, body image, and relationships. Empowering women with knowledge about breast cancer can help them navigate these challenges and seek necessary support. Hello, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we'll talk about the condition of breast cancer. So join us as we welcome Dr. Nikita Chauhan, an experienced obstetrician and gynecologist who will share valuable insights on the impact of breast cancer on women's health. Dr. Nikita is a dedicated obstetrician and gynecologist who has been providing her expertise in Noida. She is committed to providing dignified maternity care and aims to combat misinformation surrounding women's health by using clear and straightforward language. Her areas of specialization include pregnancy and childbirth, adolescent and menstrual well being, high risk pregnancies, and infertility concerns. In addition to her medical practice, Dr. Nikita is an active participant in discussions about menstrual hygiene, reproductive health, and contraception on social media platforms such as Instagram. Dr. Nikita, THIP Media welcomes you, ma'am.
Hi, Soumya. Thank you for having me here. It's my pleasure.
Thank you so much for being with us today. So, Dr. Nikita, as we know that breast cancer could be a life-threatening condition. जानलेवा हो सकती है अगर हम उसको इग्नोर कर देते हैं. So, I'm going to start off this discussion by simply asking the most fundamental question: कि breast cancer क्या होता है? What is breast cancer, and how can we distinguish between its different forms?
Sure. Whenever the cells of any body tissue start growing abnormally and in an uncontrolled way, then it is known as cancer. So,
Right.
Our breast has a lot of different types of cells. There are cells which form the glands of the breast. There are cells that form the fatty tissues, the connective tissues, and everything is there.
Right.
So, whenever any of these cells start growing in an uncontrolled way, and they start invading the surrounding tissue, it is known as cancer, breast cancer. So, there are different types of breast cancers. Yes, that is true, because depending upon the cells from which these cancers are originating.
Okay.
And the only way we can actually differentiate between the different types is to take a tiny bit of tissue, which is also known as biopsy in clinical terms, and we have to examine it under a microscope to identify where the cancer is originating from actually. So two
Okay.
main types, it can be a lobular cancer, it can be a ductal cancer. So all these are clinical, this is a clinical and medical diagnosis. But if you will ask me about the treatment doesn't vary much in the different types.
Okay. Right. So I'm sure there must be certain factors that could be responsible, for triggering the development of this particular condition. So, could you help us understand the specific factors that elevate the risk of an individual, when they're acquiring this condition?
Okay. So, you see, breast is a tissue that throughout our lives, it keeps on going certain changes. These
Okay.
changes are definitely hormonal dependent. The major
Okay.
hormones, the major female hormones are estrogen and progesterone.
Okay.
So even in our regular cycles, the level of these hormones vary, and that is
Mhm.
why, because of these hormonal changes, some women will experience some sort of breast pain or breast discomfort, depending upon which day of the cycle they are. So,
Okay.
so because of these many things, the breast cancer mainly depends upon the cancerous changes mainly depends upon these exposure of these hormones.
Okay.
Okay. So, for instance, if somebody had an early menarche or if
Okay.
she had a late menopause, the exposure, the duration of exposure to these hormones is increased for her. And that
Okay.
is why there is an increased risk of breast cancer also.
ठीक है.
Apart from these things, the risk of breast cancer increases with age. You know, especially when a woman crosses 40, she
Mm-hmm.
should definitely focus on getting regular screening done, regular checkups done
जी.
to catch this cancer in an early stage.
Okay.
Other things like delaying first pregnancy
Mm-hmm.
beyond 35 years of age, this will also increase the risk for a breast cancer.
Okay.
The reason why this happens is because once you're pregnant and once you start breastfeeding, that is when
Mm-hmm.
the final maturation of the breast tissue will occur.
जी.
So, if this is delayed, the risk of cancer is also delayed because the breast tissue is still immature and still liable to cancerous changes.
Okay.
And obesity is again a risk factor because if a woman has a high BMI, if the visceral fat is high, that is something which is hormonally active.
Okay.
So it will produce increase estrogen hormone. So this
Okay.
increased level will again predispose the women to breast cancer.
Mm-hmm. ठीक है.
So on top of my, I think this is the most common reason, most common risk factors. But
Mm-hmm.
unfortunately, none of these risk factors are modifiable. That's what I feel.
Okay.
See, there are some studies which show that use of oral contraceptive pills or hormonal replacement therapy after menopause, they also increase the risk for breast cancer because again, these are hormonal preparations.
Right.
But if you stop, once you stop these pills, and
Mm-hmm.
depending upon the duration that you have taken, roughly after 10 years of stopping these pills, your risk will be similar to the person who has not taken these medicines. So what I'm
Okay.
trying to say that if you ask me, is breast cancer preventable? I would say no, it is not preventable. The only thing that we can do is we can detect it in an earlier stage.
Okay.
So,
Right.
and
हाँ जी.
yeah,
Please.
so maintaining a normal BMI, of course, is definitely recommended because that
Mm.
lowers the exposure to estrogen hormone.
Right. ओके. सो आपने जैसे बताया कि ये कंडीशन प्रिवेंटेबल नहीं है और मेनली हार्मोन से इन्फ्लुएंस्ड है. अदर दैन द अदर फैक्टर वुड बी बीएमआई. सो क्या इसके अर्ली वार्निंग साइंस हो सकते हैं और क्या ये वार्निंग साइंस जो हैं स्टेज ऑफ द कंडीशन पे डिपेंड करते हैं, कंडीशन की स्टेज पे डिपेंड
Yes.
करते हैं?
See, the reason detecting breast cancer is important in early stages because if you detect it and if you treat it earlier, the
या.
chances of survival are very, very good. More than
ओके.
95% actually. But
राइट.
sadly, इंडिया में इतनी अवेयरनेस नहीं है ब्रेस्ट कैंसर को लेके. लोगों को पता नहीं होता है कि हम कैसे ब्रेस्ट कैंसर को कैसे हाउ वी कैन कैच होल्ड ऑफ इट अर्ली. Most
यस.
women they are not doing self breast examination, you know,
राइट.
which is something that we can do at home. It should be once you have crossed 30, you should definitely do it at least once in a month.
ओके.
And once you're done away with your periods, 2 to 3 days later is the good time to do a self breast examination.
ओके.
Why? Because that is when these hormones are pretty low, and any changes in the tissue texture that they routinely cause is not there. So you can
ओके.
actually, you know, feel your breast tissue. You
हाँ
can
जी.
basically self breast examination is being aware of how your breast normally looks like, how it feels like, so that whenever you are able to identify, whenever you feel that something is abnormal, you can catch hold of it early and you can
राइट.
get a doctor's advice. But
ओके.
even this self breast examination, it you know you can still miss cancer because sometimes the growth will be too small that you will not be able to feel anything. So
राइट.
how to detect it in that stage? That would be through routine imaging.
ओके.
So routine imaging basically means mammography. That is
राइट.
basically an X-ray for your breast.
ओके.
Once you have crossed 40, ideally every woman should get a mammogram done once or twice in a year.
ओके.
Um, many guidelines they say that we should not do it in young women who are
Okay.
especially who are less than 25 years because it increases the risk of radiation exposure and
Okay.
that if you already have certain risks, certain
Mhm.
hereditary predisposition towards these cancers, this
Okay.
radiation can actually precipitate breast cancer. So
Right.
anyway, in young women, we are not doing mammograms, but
Hmm.
after 40, I would say you should not miss them. And
Okay.
don't go for a routine mammogram on your own. Like, see a doctor first and get it recommended by them and
Hmm.
then get it done.
Okay.
Because, sorry, sometimes your doctor might feel that an ultrasound or an MRI might be a better option for you, considering your risk
Right.
factors.
Right.
So, apart from self breast examination, routine mammograms, the other important thing is clinical breast examination. That
Okay.
means you should see a doctor in person
Hmm.
every once or twice in 3 years and let the doctor do a thorough check. So,
Right.
because they are experienced in these things, they are able to identify any abnormality much better.
Right.
So, this is how basically you can detect cancer
Hmm.
earlier.
Okay.
If you have a family history of breast cancer
Right.
and you have been tested positive for certain mutations which
Hmm.
are responsible for breast cancer, then you have to start these mammograms a little earlier.
Okay. So you just mentioned about the early detection by either self-examination or a professional clinical examination. So I would say that for ones who've been detected with breast cancers, what are the primary treatment modalities available for such patients? And
Okay.
how do these treatments differ, based on the specific stage and the type of breast cancer?
So, stage one is basically a tumor which is less than 2 centimeters and it is strictly confined to a single breast. In a young woman,
Okay.
having a removal of breasts can be, it can have body image related issues. She might get
Yes.
depressed because of that, and
Yes.
she might not be able to accept herself after that. So
Absolutely.
there are a lot of emotional and mental issues that a woman might face. So
Right.
if a cancer is detected early and if it is very, very small in size, the
Hmm.
surgeon, the oncologist, they might recommend that we
Hmm.
can simply remove this tumor.
Okay.
Okay. We can simply remove this tumor and we can follow you up for the rest of your life. Because
Okay.
obviously, once you've had breast cancer, the chances of recurrence are very much.
Okay.
Now, once this staging, the tumor has advanced and it involves the lymph nodes also,
Hmm.
then it becomes extremely important that we do an extensive surgery. It might need it might, it might need a mastectomy, a complete
Okay.
mastectomy, and a lymph node dissection. So
Okay.
it depends upon the stage a lot. And most doctors nowadays, like they do recommend adjuvant treatments also, which
Okay.
means that once the surgery is done, to ensure that the survival rates are high, they might recommend radiotherapy, they might recommend chemotherapy, depending upon the
Right.
type of breast cancer. Sometimes it is, because like we discussed, it's a hormonal, it's a tissue which is responsive to the hormonal changes in the body. So there are
Okay.
certain medicines which target this aspect of breast cancer, and
Hmm.
we can treat them accordingly. So
Okay.
a lot of it depends upon the staging, the type of cancer, and molecular diagnostics and everything.
And once you discuss the treatment part, I have something very, मतलब I really want to ask. I'm really curious to know about this. That कि आजकल, you know, we've been telling women, खासकर young girls and women, कि there are a lot of lifestyle changes coming in. There's a lot of alcohol consumption. There's smoking. And you just mentioned that breast cancer is something which can probably not be prevented. It has to be detected early. So I'm still going to ask that, are there any lifestyle changes or preventive
Yes.
measures that you could still, help
Sure.
reduce the risk of cancer?
So if you're drinking alcohol daily, if you're consuming more than 1 to 2 units daily,
Yeah.
alcohol consumption has been linked to breast cancers. There is no
Okay.
denying that.
Okay.
So, especially if you are genetically predisposed to breast cancers, you should avoid alcohol at all costs.
Mm-hmm.
And okay, for see, a recent study was published in which they said that no level of alcohol consumption is actually safe for your health. So it's
Okay.
a good idea to better avoid it completely.
Mm-hmm.
And apart from that, yes, maintaining a healthy BMI, doing routine exercises, indulging in yoga, meditation, cardio, maintaining a healthy weight is a very good idea, and it reduces your risk of breast cancer. Definitely. There's no denying that.
And like you just mentioned that, even after, meticulous treatment or an effective treatment of breast cancer, there can be a lot of mental issues, right?
Yeah.
So can you provide information about support groups or support networks and associations which are accessible to individuals who have received, let's say, breast cancer detection or diagnosis or even treatment?
Yeah, so actually, I was very happy when I did some research on this, and when I asked my friends who are treating advanced breast cancers,
Mm-hmm.
and they told me that there are actually a very good, very functional and very supportive groups available in India, in our country. There are multiple NGOs that are working towards spreading breast cancer awareness, and they
Mm-hmm.
provide emotional support. They provide all sort of information there is once you are diagnosed with breast cancer, or if you are somebody who has a relative with the breast cancer and you want to know how you can reduce your risk of breast cancer. So yes, I asked my colleagues about it, and they gave me a list of names.
And another thing that as a doctor, I'm sure you must be coming across a lot of curious patients, right? The ones who want to know about a certain condition, for their basic knowledge and just to take care of themselves. So, in context with those patients, I would simply ask that why do you think that as a professional, as a medical professional, health literacy is important for understanding breast cancer? And how can your patients, or let's say individuals in general, improve their comprehension of it?
Okay, so as a gynecologist who sees female patients, women, girls of all ages, most commonly when these women will do some self-breast examination and they will notice a lump and they will get very, very anxious, and
Mm-hmm.
they are extremely tensed, and obviously they are worried whether it's cancer or not.
Right.
So, the first thing that I do is, okay, yes, there is a lump and it
Yes.
could be cancer, but there is a good chance that it might not be cancer.
Okay.
Okay. Because most of the times these lumps can be fibroadenomas, they can be infectious cysts, they can be, maybe somebody is a new mom and they are feeding their baby, it could be a milk collection.
Okay.
So I don't want anybody to be scared when they notice a
Right.
lump in their breast.
Yes. Yes.
So for me, this is very important that they should know what is normal and what is abnormal, and when to seek help, and when to worry and when not to worry. Because
Okay.
I feel if somebody is stressed about their condition, if they don't get the right direction, they might actually be misdiagnosed, and their condition can be missed. So I
Okay.
feel awareness regarding breast cancer is extremely important, especially because it is the most common cancer diagnosed in women in India.
Yes.
And it is the leading cause of cancer related deaths in India. So, as doctors, as healthcare professionals, it is definitely our duties. It is our duty to have the correct information about this condition and to be
Right.
able to inform patients. So
Right.
sometimes young girls will come to me and they will tell me that so and so in their family got detected with breast cancer, and they are
Right.
worried that they can also get this condition. So
Right.
how to guide such young girls about it is very,
Right.
very important. The right way to tell them, like when to start your screening. Do you need to get tested for certain mutations that increase your risk for breast cancer? All these things, and I feel every woman has a right to know that, whether
Right.
she needs to be cautious or not, whether she
Right.
needs to be specially cautious or not.
And especially in a country like ours, where there are certain misconceptions also that have been passed on from generations that actually abstains them, to visit the right professional and get the right guidance. So now, how can we address these common misconceptions and myths that may hinder, the awareness initiatives that have been started?
Okay, so first of all, whenever you notice something abnormal, seek a doctor's help.
Right,
Um, be it a gynecologist, be it a surgeon, be it an oncologist. You need to see
right,
these people and you need
right,
to get yourself evaluated, right?
right.
And there are a lot of myths and social stigma associated with breast cancer. Like most women will hear things like that. Oh, now you're not going to recover from this. Nobody
Mm-hmm.
has recovered from breast cancer. Definitely now, so this and this problem will arise. Now you will not be able to breastfeed. Now you will not be able to have kids. Now you lose all your hair and all those things these women get to hear. I want to tell
Yes,
them that these things are absolutely unnecessary. Actually, if the breast cancer is diagnosed in an early stage, the survival is more than 95%. That is pretty good. And even if it gets diagnosed in later stages, in advanced stages, the survival is still more than 70%. So
okay,
it is important to know that now we
right,
have come at a point in time where breast cancer is actually treatable and
right.
the survival rates are very, very good. And
Mm-hmm.
there is a pretty good chance that you will have a normal life once you're treated with breast cancer. And you can even conceive successfully once your
Right.
follow up with breast cancer is complete.
That was very, very inspiring. I'm sure many women and young girls would be learning a lot from these wonderful words, Dr. Nikita.
Thank you
Uh,
so much. I'm glad.
Thank you. So we appreciate your presence today. Thank you so much for sharing such valuable information with us. I'm sure it would be very relieving for many families. So thank you so much for joining us today.
Thank you so much for having me, Soumya.